Welcome to All Things Chiropractic.
Well, welcome to another episode of All Things Chiropractic. I'm Paul Andrews.
I'm Dr. Mark Davini. Welcome, everybody.
Okay, today's episode, we're going to be talking about chiropractic assistants, and specifically the certified chiropractic clinical assistants and the credential. What is that?
That's a good question. What is that?
So, chiropractic assistants.
You being the first one in Massachusetts.
Oh, yes. Give me credit where credit is due. So, when we're talking about chiropractic assistants, we've talked in other episodes about, they play a pivotal role, right? They're the first, maybe the last in the communication touch with patients. They contribute to the healing process. So chiropractic assistants who are certified, what is that? So this goes back to the Federation of Chiropractic Licensing Boards. The FCLB created this credential, this national certification.
And it's the only real national certification out there for CAs, correct?
That I know of. I mean, I know that the AAPC, where we have a couple of credentials, had some type of a chiropractic certification, but they ended that for some reason. But as far as CAs go, I mean, some states do license chiropractic assistants, but very few.
Right.
So yes, from a nationally recognized position, FCLB has created this CCA credential. And I can say that it's pretty comprehensive. The way your chiropractic assistant would get credentialed is they have to get an education first by a recognized provider. Shameless plug, Tools of Practice is one of those recognized providers.
Our CAP course, our
yeah.
Chiropractic Assistance Procedures Program.
Yeah, member offices can have their CAs take the CAP course for nothing. Non-members, their CAs can take it, but they have to pay something.
Yeah. And it's fairly comprehensive. Like you said, it's 24 hours of training, defined by Federation of Chiropractic Licensing Boards and what it is that they must know. This is taking a chiropractic assistant and elevating them to a whole different level.
Yeah, so let's focus in on the training or education because, you hire a CA, right? And so usually you might give them some training, docs, probably not. Mostly it's going to be your other CAs in the office if you have more than one. Otherwise, it would be you. And you usually focus in on the stuff that's, important at the moment, which is how do you open the office, close the office? How do you use the software? How do you collect co-payments? Things like that. Well, all of that's important. And the CAP course that we designed, which helps them be able to qualify and then also pass the CCA exam. That's important. It dives
currently, we have 100% pass rate.
Yeah.
So that's another shameless plug.
It is. So, when we look at the education, I say to myself, oftentimes, we'll get member offices, doctors that are like, one, how do I find a good CA? And two, where do I get them trained? And of course, we can help with the latter. I think sometimes, I think hiring is a gamble anyway, right? You try your best.
Mm-hmm. Especially today.
Right. But I'm always a fan of creating a career path, not a job. And so if you can sense within your candidates for interview that somebody's looking for an opportunity versus just trying to punch in and punch out, you can create a more robust environment in your office by offering this type of credential as something they can achieve.
And let's face it, I mean, in chiropractic, we don't have those formal courses that, say, medical assistants have or dental assistants have. And this is an attempt by the Federation to elevate the position of a chiropractic assistant to be that paraprofessional, to be that person that works alongside you, to define their duties. We always like to say the ABCs of being a chiropractic assistant. There's the administrative, the billing, and the clinical. So they take this to that level where they're saying, okay, you're not just somebody off the street, and no matter where you came from and what your jobs were before, when you're done with this and when you get certified as a triple CA, you are at a different level.
What I like about the Ccca and frankly our education program leading up to it is that it doesn't focus in on just one area. It starts with the history of chiropractic, and then it goes into terminology, it goes into the administrative, but also, and it focuses heavily on the clinical aspects of a CA, because depending on your state and jurisdiction, of course, but a lot of them allow CAs to participate in the clinical contributions of the healing process with the patient.
And that allows procedures to be performed by the CA while you, the doctor, are doing something else.
Exactly. So when we look at this, I say to myself, what a great career path this can be for somebody who perhaps is searching for a career and they see your ad in the paper, or people don't read papers anymore, do they?
Papers. Oh my God.
Dating
now
myself.
Who's dating
I know.
himself? Yeah.
Well, I'm so embarrassed.
Oh, that was funny.
All right. Craigslist isn't even a thing anymore, is it? It's like LinkedIn, Indeed.
Oh, I mean, everything is so
digital,
integrated with itself now. I'm not even sure what's separate and distinct.
I know. But so, you find these candidates and you say to yourself, okay, obviously, when we've talked about generations in other episodes and sort of how navigating those kinds of things. So you find a couple of candidates that resonate. Wouldn't you want to provide an opportunity for them to grow quickly in their education and knowledge, and also without you having to do a lot of it?
I agree. It's perfect. And also, it gives you an indication of their commitment to the job. So if all of a sudden they want to participate in this program and learn what they need to learn, pass tests, and get certified, that's saying something about them and their desire to become a professional, to someone to work alongside you, not just fill the spot and collect the pay.
Right. So maybe some out there are saying to themselves, well, I'm going to have to give them, pay for this education, or I'm going to have to give them time also to create this education. Yes.
Exactly.
That's the investment, right?
But how much are you going to pay this CA compared to how much they can generate if we're going to just talk pure business aspect of things? How many modalities might they do in a day that wouldn't be done otherwise, because you would be the one doing them and there's only so much you can do in a day? So this definitely allows for the opportunity for you to expand services in your office and see more people. Both of them. So yes, they are going to command a greater pay, and they should have a greater pay if they're certified, because they are at a higher level and have demonstrated a higher level of commitment to the profession by doing this. But in return, you're able to generate and complete more business.
I think the return on investment is pretty simple mathematically, and it's really robust in the sense of getting back more than what you're paying out. But I also look at it and say to myself, there's a certain pride that a chiropractic assistant could have, because when you pass an education course like our CAP course, you get a certification, or you get something put on the wall, and then you go to the FCLB's website and they enroll to take the exam. When they pass, not if, when they pass, they get this nice wall certificate they can print out. They get an ID badge that comes in the mail that they can wear. And, there's a certain pride to that you'd want to lean into as an employer and a doctor, to say, this person is committed, so I'm committed to them.
Right. And let's remind you, we've mentioned this before. The CAs spend way more time with a patient than you do. So if this CA is incompetent, doesn't understand chiropractic, isn't able to answer questions or stimulate referrals, how much business are you really losing by having that uneducated non-professional have all this contact with a patient.
Right. When I look at it and say to myself, the healing process, Parker talked about this a lot, it starts the minute you talk to them, the minute they contact you, the minute they walk in the door, and you want to be this oasis. And what's a better way of training them, obviously one-on-one yourself, but also giving them as many resources as they can so they can even ask questions and be able to navigate that.
Oh, it's critical. I'll even give you a little personal example. I had a spot removed off my ear, which was benign. Nobody out there panic. I'm still going to live. And I had this spot removed in my ear. So I walk into the room and the medical assistant comes in, explains everything that's going to happen, and then does the numbing of my ear, lays me down, puts me in position, drapes me all up, gets me ready. And now the surgeon walks in. Surgeon says, hello. I did happen to meet the surgeon before, but that was by choice. It wasn't part of the normal procedure to meet the surgeon in advance. He comes in.
That's kind of weird, isn't it?
Yeah, I know. He comes in, does his thing for 10 minutes. Now, I've already been with the medical assistant for 15 to 20 minutes, getting all this other stuff done. I'm lying there on a table, still all draped over with my head. All I could see is the floor. I basically see his shoes. He says, well, everything went well. I don't see any problems. So-and-so is going to go over this with you. If you have any problems, let me know. Nice meeting you. And I saw his shoes walk out the door. And I get up. She straightens everything out, cleans me up, spends 10 minutes bandaging my ear. It looked like I just came out of a Rocky movie. Spent 10 minutes bandaging my ear, goes over all the home care instructions with me and my wife, and basically spent another 20 minutes with me. So out of this almost hour appointment, I spent 10 minutes with the surgeon. My experience, my positive experience, didn't come from the surgeon. He basically, to me, appeared to be a competent technician.
The mystery man.
The mystery man, right? The doctoring came from this medical assistant. And I was very pleased with the service, and everything went well, and that's the way it ended up, not because of the doctor, but because of the medical assistant.
So that leads me into thinking, even if your chiropractic assistant couldn't do everything that you'd want them to do because of your jurisdiction or scope restrictions, the knowledge that they would have to be able to reinforce the education or answer basic questions so you can be with other patients and demonstrate the confidence the overall office has and competency with the clinical aspects is huge to me.
They're going to ask the questions to the CAs. Why did he do this? Why did he do it? Or she did it that way? Why is it that I have to come back? All these questions that you think you answered in the report of findings and the patient didn't hear any of it, they will ask again and again and again to your assistants. And if your assistants don't have good answers, then you may lose a patient, or maybe you won't lose that patient, but that patient won't feel comfortable referring other patients. I mean, this is a business decision. If nothing else, it's a business decision to have the most competent individuals in your office. And if you feel that that's not important, then you probably don't even know how much business you're losing because you feel that way.
And couldn't it be a filter to understand your current and potential employees by saying, hey, there's this education you'll take online, and then there's this exam, and you could be nationally certified. And if they're not feeling it, it might give you a tip off of what type of, and hey, sometimes that's what you want. If you want a drone at the desk that's, not shy about collecting, but doesn't want to move forward in their own education. Okay. You can make that.
But it really isn't.
Yeah. I mean, it isn't, but
you may choose it, but
actually,
it's not good business. It is not good business.
I don't know if you've noticed this, but I've seen that it's the fearlessness of asking patients for money over the desk has waned, I think, with certain CAs or CAs in general. I think it can be more difficult. I mean, I think Parker called it a poverty complex, right? If you're struggling personally with finances, you're less likely to ask patients for their higher and higher copays. I mean, I get it. If someone's $45, $50 copays, it's
self-esteem is everything.
right. So propping them up legitimately and genuinely with, this kind of education and reinforcement of their abilities.
Right. Enhancing their knowledge of chiropractic so they have that same commitment and belief in what you do so that they can give that back to the patients. So when they ask for that money, their mind isn't, oh, wow, that's a lot of money. Let's hope I can collect it. It's, boy, this is pretty cheap for what you're getting. That's where you want them to be, not the other way. And we kind of went through this a little bit with the typecasting podcast we did a while back, that not everybody has confrontational skills. And certainly you want that person who's at the front desk anyway to have confrontational skills. And so this is one of those things that gives you an opportunity to vet your own staff and find out where they fit best in your office.
And, so I was on the Ccca committee for the FCLB a number of years ago. So I was able to sort of see their process on, I guess, maintaining the certification and the exam. And I have to say, it was a pretty thoughtful and extremely vetted process, because the questions themselves I was not privy to because we were providers, so I couldn't get to the questions. Darn it!
Yeah.
But the questions themselves, psychometrically verified and vetted, and at the end of the day, the amount of, let's just say, the eclectic sort of approach that they have is really, to me, shows the kind of education that you can provide your CA. Because again, it's not just, is a hot pack going to burn somebody if there's no layers, right? It's about,
they know what they're doing,
why you're doing it, what you're doing, how to approach it with the patient, how to reinforce the safety aspects of it.
And they're actually as a backup to you. So they have your back. They know enough to watch what's going on and assist you in not just the care, but in the observing the patient and how they respond to care. Because again, remember, they spend more time with the patient. So you want somebody knowing what they're doing when it comes to them spending all this time. And like you say, what if the patient had a burn and they didn't even know what a burn looked like, or they weren't educated on what to do if there was a burn? There's so many pluses to having a competent team member, because a lot of people use that word, but I got to tell you, sometimes when they use that word and I go into their office and I'm looking around going, there's not much of a team here. You may use the word, but you don't live the word.
I'm going to embarrass myself again here, but I remember when I started as a CA a few decades ago, there was no Ccca.
That's
there
kind
was
of different, huh? He's making fun of his own age and not mine.
Well, trying to get ahead.
I'm uncomfortable here.
I'm trying to get ahead of you. We're talking about CA, so talk about myself. Yeah. So, 20 plus years ago, there was no Ccca. There was no CAP course. There was no tools of practice to teach. So how did I learn? I learned by other CAs in the office, and their basic training was, pull up their shirt, look at the area, put these 4 pads on in a square, make sure that the colors are diagonal.
Hit the red button.
Hit the button until they tell you that they can, it's comfortable. Yeah. Put the hot pack on top of it. I can't, more than once, I have left a patient beyond the timer. Forgot about them. Oh, yes. So embarrassing.
Yeah. Yeah. And then you come back in and go, you were particularly bad today.
No, I came back in and the hot pack's on the floor, the leads are on the floor, and they were gone. Oh, it was awful. Oh, I was like, oops. Why? Because I wasn't trained to carry a timer on my hip or, have it where I could hear it. Yeah, something. So that was embarrassing. And so, of course, I didn't want to blame myself. So I blame my training, right? Hey, if you had trained me better, but it was embarrassing. And so I'm not saying these things might not happen even with a Ccca, but
you also have the concept of compounding errors. So if you have somebody training you and the person that trained them didn't do a very good job, then what happens is that now that person is now training you, who is going to make another CA that doesn't do all that good a job, and so on and so on and so on. And the errors become almost unidentifiable as the source because it becomes the way. And you ask them, why do you do that? Well, it's the way I was shown. Then you go by so-and-so. Then you go to so-and-so and say, well, why do you do that? Well, it's the way I was shown by so-and-so. And you trace it back to, the old Italian story about the cutting off the ends of the ham, and rubbing them together.
I had the one about the chicken. You cut it in half first, and that was because originally the oven was too small.
Yeah, or the pan was too small. With the ham, the pan was too small, so you had to cut the ends of the ham off.
Yeah.
But we made this big story up about how you rub it on the ends and it keeps it moist and all this. And no, it was really probably originally because the pan was just too small or the oven was too small. And so
it's like that game Telephone. But see, we just did it because the same story we have, but very different.
Very different.
Same moral, but.
And there we go. Right. So that's why we're saying by having a standard, which is really what HIPAA was created for, was to create standards. Well, this is one of those standards now that said, if you're a CCA, we know what you know.
Well, this leads me into two points. First point is, if a CA hurts a patient, who's actually going to be responsible for that?
You, the doctor.
Right. And so you're in medical malpractice defense. How well are you going to defend a doctor who says, well, my staff person who I've had for 20 years showed them how to do it and they did it wrong, but there's zero documentation, zero record of that education other than word of mouth?
Well, if I was the plaintiff's expert, we were trying to, in a sense, get this person. After I stopped laughing, I just tear it apart, because the bottom line is you are the respondent superior. You are the one who everybody answers to. And
he likes to throw that around because he's the doctor and I'm the CA in the room. He loves to throw that term around.
Well, the bottom line comes out to be, I am the chief cook and bottle washer. How's that?
Yeah.
Right?
Superior. You just like throwing that word around.
There you go. I am the chief cook and bottle washer, and everything falls back on me. It's the same thing in your world. How many times do they try and blame their billing CA? Well, I don't know. I don't know anything about coding. I have my billing company, or I have my CA do that. And guess what? Doesn't work. You are ultimately responsible for everything that goes on in your office, including whether or not your staff is competent at what they do.
So to me, having an education and then the credential and following that standard of care, doesn't that give you a really good defense?
Absolutely. You say, look, this wasn't my standard. This is the standard.
Ooh, capital T on that one.
With a capital T on that one.
The other thing I like about going back to CCA is that every 2 years, within 2 years, to maintain your CCA and renew it, which is minimal, there's 6 CEUs that you have to take. What I like about that is, one, you continue to invest in your CA, but also as emerging technology and other modalities that you may introduce into your office come into play.
Oh, that sounds like a good podcast.
I think it is, actually. Actually, yeah, it kind of is. All right. But as that happens, your CCA can take that type of education with you to participate in the clinical care and be educated on something that might be new in your office.
A true team member. And the care ends up being a true team approach, not just in name only.
That's true, because when I look back at my early career as a chiropractic assistant, I had pretty good training with the basics. Some on the computer, some of how to navigate some insurance. But I didn't have a ton of good training on the clinical responsibilities that were given to me. And so my attitude was that these were pretty benign procedures because there wasn't a lot of weight in the training, right? So putting somebody in a hot or cold pack, I didn't think too much about it because it was like, the training was like, back when hydroculators, sometimes we still use them, but, take the tongs, put it in the then
Right.
put a couple layers and just throw it on the patient.
Which back then was the number one malpractice complaint was burns from hot packs.
Yeah. And then after one time of like basically plopping this hot pack on a patient's back and they're like, oh, I realized maybe I should do that a little more gently because it is weighted and they are here. So,
And they hurt.
Yeah. And then not pulling up the shirt and then their shirt's soaking wet from the condensation, the moisture, whatever. So, but I said to myself, in retrospect, that was pretty stupid of not just me, but also those that were training me, because if they were so benign, why were we doing them in the office in the first place?
Yeah. If it didn't have clinical value that could not be obtained more easily and less expensively in another way, then we do it. But if those things can be done at home or they can be done less expensively and just as effectively, then maybe we shouldn't be doing it. So becoming a Ccca makes the CA aware that they're not just doing this benign thing, that there actually is a clinical procedure that is skilled labor. It's a skilled service. It's not something that anybody can do in the same way. And again, going back, it gives them self-esteem. It makes them feel like they are participating in this patient's healthcare, which they are. Whether they intend it or not, they influence a person's recovery one way or the other. We're just hoping that by bringing this point out to you that you will recognize that there's a better way to do things.
Yeah, I really am just a big fan of creating this career path that we kind of talked about at the top. Like having that career path. I mean, even advertising, like we've seen some of our members, they say, hey, we're looking for a Ccca in our area.
Yeah.
Well, if you advertised that you're looking for that and you will, train them for that in itself might be a good filter to find someone who's looking for more than just punching in and punching out.
Yeah. Well, if we were to leave this with one thought, maybe it's something as simple as this. Don't just do better.
Ooh. Sounds like one of those sports, like Nike commercials.
You said,
or
who
something.
said that? And I'm going to say, me. I just did.
You better look that up.
Do better. So if somebody else said it, I didn't intend to steal it, but I'm going to take credit for it this moment. So
I used to have an acronym with my boss, JIFTY, just blank do it.
Yeah. Right. Pretty much. Yeah. It's a takeoff on the athletic shoe advertisement, right? Okay.
Yeah. So doctors, if we've convinced you at all to take a look at it, you can head over to synergyceus.com and look at our CAP course. If you're a member, you can access through your Tools of Practice login for the members side. FCLB.org is where the Ccca is housed. You can look at that. They have tons of resources on, there's a whole code of ethics and there's a lot of information there, also study guides and things like that. So anywho, thank you again for listening to another episode of All Things Chiropractic. I'm Paul Andrews.
I'm Dr. Mark Davini. Thank you all.
Thanks for listening to All Things Chiropractic. We'd love to hear from you. Visit allthingschiropractic.com with comments, episode ideas, or questions. Or connect with us on Facebook and Instagram at All Things Chiropractic Podcast. Be sure to join Dr. Mark Davini and Paul Andrews next time for another episode of All Things Chiropractic.